All right, so I'm the last one. I'm the one who's going to hold you guys up here. So it's a pleasure for me to be here today. I was previously at the National Cancer Institute before coming to NIA. I'm very happy to be here wearing 3 hats at NIA: Program Officer, Branch Chief for the Population Studies and Genetics Branch, and also the Minority Health and Health Disparities Coordinator for the Division of Neuroscience. And so over the next few minutes, I will share my division's vision for supporting resources to address minority health and health disparities, and describe this within the context of what we see as important in addressing these issues, using a precision medicine and precision public health approach, and of course the health disparities framework, which was created by my friend over there, Dr. Hill, who did a wonderful job at presenting. Is doing a wonderful job at AA right now. And then just provide you a brief overview of the division and some of the research and the research resources that we support. Okay, so the point of the slide is just to remind you that there are various ways in which an individual or population may identify, and that we need to understand, we need to remember that these various ways by which a person identifies may intersect with each other and may all play a role in one's risk for AD and related dementias. And then we also have to understand the context of the environment that an individual and a population is in. And so what this figure represents, does this have a pointer? Okay, so what the figure over here represents is the exposome. And we all know that the exposome is defined as exposures that one may experience over the life course, and it's associated or it may affect a person's health. And so there are many different components to the exposome. We could look at this in terms of the ecosystem, in terms of someone's lifestyle, and the exposures that they are, the things that they're exposed to based off of their lifestyle, social exposures, and also physical and chemical exposures that may come about based on where you live, or it may come about based on where you work. Okay, and these exposures are all relevant over one's lifetime. And trying to click down and it's not working. I think I'm frozen. Here we go. And then we also have to remember that a person may have different comorbidities. So they may be understanding what the familiar medical history is. One example of that may be genetics, Down syndrome or autism, and then understanding how other comorbidities that are associated with AD and related dementias, such as cardiovascular disease, HIV status, an emerging area which we started looking at, which is oral frailty or oral health, how that all relates to one's risk for AD and related dementias. And so we could start to put this together and think about how precision medicine approaches could really help us to understand one's risk for AD and related dementia, and how this approach could help us to come up with the best treatments or the best prevention strategies for that individual. And so precision medicine, the NIH definition, is an approach for disease treatment and prevention that takes into account individual variability in genes, environment, and lifestyle for each person. So on this figure, you would look at things like different omics, the types of medications a person is taking, the environment that they're living in, and so on, and use all this information to really design a treatment and prevention for disease. And then we could extend the idea of precision medicine to precision public health. And precision public health is really about delivering the right intervention at the right time, every time, to the right people or to the right community, okay? And so it's really looking at the study of interactions between biological, genetic factors of personal, environmental, social determinants of health to really monitor the incidence of disease in communities, and then to think of targeted, effective interventions within that population. And our health disparities framework, which I mentioned earlier, really helps to push this idea forward of precision medicine and precision public health approaches in addressing minority health and health disparities. And so we could consider that the framework here, it considers multiple domains, multiple levels of influence across a life course, and it looks at and really describes how all of these domains and influences work in concert to cause disparities and affect the health of minority populations. And so I think I skipped over a slide. Yep, I did. So our mission in the Division of Neuroscience is to really advance research leading to better understanding of mechanisms of brain aging and aging-related dementias. We support the research at the population level through support of longitudinal cohorts and other population-based studies, looking at things related to discovery, translational, clinical interventions, and diagnostic research. And just as important, we use in vivo and in vitro model systems to understand the mechanisms and the biological pathways of a disease. So within our division, minority health and health disparities and health equity is cross-cutting. Each branch supports research that strengthens the scientific knowledge for minority health and health disparities that will inform prevention and intervention strategies for the minority population. And the depth and breadth of scientific expertise within the division allows us to develop and support infrastructure that would allow for precision medicine and precision public health approaches to looking at AD and related dementias. And so this shows really that we use a bench-to-bedside approach, which allows us to foster a robust research enterprise to really investigate the causes of AD and also to support research that will inform treatment and lead to prevention for AD. To do this, we support a wide range of research infrastructure and programs, and it's important for us to integrate these programs together so that they're leading to novel scientific approaches and accelerating the pace of scientific discovery. So over the next few slides, I would just present examples of some of what we support. So this slide shows a few of the longitudinal population-based studies and cohorts, which are among the key approaches that we use for advancing understanding on the complex etiology of AD, and it provides fundamental insights into environmental, social, cultural, behavioral, and biological risk factors responsible for this disease. So we support several longitudinal cohorts that look at diverse populations, as you can see listed here, African Americans, American Indian, Alaskan Native, Hispanic, Latino, Asian Pacific Islanders, Arab Americans, and so on. So this is one example of the studies that we support. This is known as this study is a health and aging brain study, or the HABS HD. This represents a significant investment by NIA. I believe that we are supporting this study at $148 million over the next 5 years. The goal here is to really continue to longitudinally follow 1,500 Mexican Americans and than 1,500 Blacks or African Americans in the Fort Worth, Texas area. They're going to be collecting a lot of information on this population, a lot of omics. In addition, PET, MRI, blood, CSF, social, cultural factors, and then they're going to integrate all of this information to really begin to understand how all of these factors intersect and work together to contribute to AD and related dementia outcomes. What's also important is that they've started enrollment of younger populations starting at age 30. And so what they're doing, also going to do over the next 5 years is enroll an additional 1,500 500 from each one of these populations, age 30 to 49, so that they could start to follow, look at preclinical factors related and how this population will go on to develop AD. Okay, and then we also want to continue to increase the diversity of populations within our studies. So this is one example by which we are doing this through the creation of a funding opportunity that really begins to provide a catalytic opportunity to build out new longitudinal studies on minority populations. And so this funding opportunity stressed a few things. So one, we wanted this to focus on populations that were understudied or not well represented in AD and ADRD research. And then it also focused on bringing together transformative multidisciplinary teams to address disparities, health outcome, disease burden, or resilience among those populations. And then we wanted them also to do some pilot projects to incorporate multi-level assessments and approaches to really start to understand how all of these factors intersect to look at AD and related dementia outcomes in these populations. So we're happy to say that this funding announcement was very successful in picking up 5 new studies focused on Asian Americans, Hispanics, African Americans, and we're looking forward to seeing the type of research that emerges from these studies. And then many of you may be familiar with work from Amy Kind using the Area Deprivation Index, or ADI, to really understand how one's neighborhood and other neighborhood factors could really contribute to AD-specific pathological features. And so she is working with another investigator, Dr. Benlin, and they're expanding this study across the U.S. using participants from 22 ADRCs, or the Alzheimer's Disease Research Centers, to really look at how one's neighborhood and other moderators of life course exposome can affect AD outcomes in their populations. And we want to continue to push this type of research forward. What we've observed in our division is that our cohorts are great at collecting patient demographics, family history. They have a lot of genetic information. Lifestyle questionnaires is great, but what's really missing is the environmental exposure data. And so we created a new funding opportunity, which is still out on the streets. And this funding opportunity encouraged the quantifying of toxicants in biological samples. So what we're trying to do is to get an idea of what the internal dose is after the exposure, and how that internal dose is associated with disease outcome. And so we're asking our investigators to add measures of exposures to individual toxicants or combinations of toxicants, and then also we see how this relates to multi-omic molecular profiling. So Dr. Bird presented on some of this information, but the ADSP, which is the Alzheimer's Sequence and Disease Project, very large, very complex, very productive group of investigators that have really contributed to our understanding of genetics and genetic variants associated with AD. And their primary focus right now is just to increase the diversity of populations within the ADSP. So this is just an example of where they are right now in terms of being able to do that. And very happy to serve as PO for the U19 grant that Dr. Bird presented, focusing on sub-Saharan Africa. And very happy to say that we have a funding opportunity that will be emerging to build AD infrastructure in Africa, so that we could start investigating causes and relating it back to our African American populations here. This was touched on a bit earlier. This slide is really to emphasize the importance of including diverse populations in our clinical trials. I believe the previous presenter from Eli Lilly touched on this. This was on the A4 trial where they really aimed to identify diverse populations but failed to do so because the eligibility criteria for amyloid. So what they found and what is supported by other studies is that the amyloid positivity in African Americans and Mexican Americans or Hispanic populations is much lower in those populations compared to non-Hispanic whites. And so it just really emphasizes the importance of including diverse populations in clinical trials. This is something that NIA has been pushing for a very long time. We'll continue to do so. So we have the AMP-AD 2.0, which expands the multi-omic profiling and samples of diverse cohorts, also aiming to generate longitudinal immunologic profiling data across diverse cohorts and to expand existing molecular profiling within diverse populations. We also support diversity, recruitment, and retention work. So this was a funding opportunity which supported 15 projects looking at ways to recruit and retain populations that are medically underserved. So we got a great diversity of populations represented in these projects based off of race, ethnicity, languages spoken, and also other things that we don't often think about in medically underserved, such as the oldest old, the hearing, vision, mobility impaired, sexual gender minorities, rural populations, and other under-resourced populations. And one of these studies, we're really happy that one of these studies are going to come back in again and will be funded for an additional 5 years of support to really hone down on the science of recruitment and retention in this particular population for Asian Americans. So we could imagine that, yes, we start off with the initial registry population. We're referring patients for clinical trials, but who's being retained in the registry? Who's being referred, how many are actually going to be eligible for the clinical trials, how many are actually going to be able to participate. And so what this investigator, Dr. Van Park, will do is that she will continue to examine factors that are associated with attitudes and willingness to participate in health research, and then seek to employ innovative approaches to identify registry retention strategies, develop and test effectiveness of new retention strategies, and target efforts to promote care registry participants in agent studies and assess the factors associated with actual research enrollment decisions. And using this information, continue to see how we could pursue and ensure that Asian Americans are continued to participate in clinical trials. And so you can imagine that we are taking, again, all of the infrastructure that we're supporting and studies, that we're using all of this data, harmonizing, integrating this data to really inform personalized medicine and really inform precision public health approaches for different populations. So I'll stop here. Funding opportunities, please visit this link. I like to encourage people to read our blogs. It's called Inside NIA. You do get a lot of great inside information. And of course, visit us on Facebook, Twitter, and YouTube. I'll stop there.
Thank you.